Hey guys, good evening. We're going to learn how to write a letter. We're going to learn how to write a letter to different people, which means when you write to a medical professional and when you write to an allied healthcare professional, what is the difference in the second paragraph or the body or the content of the letter, right? So just note down whatever I'm saying. This is going to be your homework, and you're going to give this, you're going to submit this tomorrow, and I'm going to evaluate, okay? So let's read this first. Let us understand and see how the content of the letter, how the language of the letter changes depending on who the receiver is. Yeah. To cut down the story short, here, not this one, wait, this letter. So we have two different recipients of the letter. You see at the bottom, write a letter to home health nurse, Mr. Minsuk Park, who will be visiting Mr. Shaw every day. Use the information given in the case note to outline the home care treatment plan and management for blah, 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 blah. Right? So who's receiving the letter? The receiver of the letter is a nurse. And you are a nurse doing OET nursing. So the receiver of the letter is also a nurse. Right? So OET categorizes medical professionals under the name of nurse and doctor, nurses and doctors. Anybody who's not medical professionals, such as physiotherapists or occupational therapists, they are called allied healthcare professionals. And they are non-professionals also, um, like social worker or director of a certain, care home or director of a, let's say, refuge center. It can vary. Okay. Now look at this one. Write a letter to occupational therapist Claudia Mayhem to outline the home assessment and management for Mr. Shaw. Yeah. So this letter is special. Of course, they're just going to give you one, not two in the exam. But this is just for our practice. We're going to learn how the content of the letter changes depending on who the receiver of the letter is. Yeah. So introduction of the letter is very. So when I'm telling this, I expect that you know a little bit about writing, and I expect that you've watched the first video that was sent to you. So here, first of all, the decision is what is going on with the patient. What do you want from the reader? Reader. So whenever you write a letter, remember, wait, we need to have two contents. Yeah. If you cannot see what I'm typing, that means you have not updated your phone or it's not the latest version of the app that you're on. So I'll speak out loud. You can note it down if you cannot see. I'm writing to, let's say I'm writing to refer Miss. So this is the way we start, right? Anything we start like this. Then there are two decisions that you need to make regarding the content of the introduction of the letter. The first decision is what is going on with the patient. What is going on with the patient? Oh, with the patient, which literally means the diagnosis, basically, or the provisional diagnosis. If there's a diagnosis, the patient says, okay, if the diagnosis is hip replacement surgery or ongoing headache or migraine, or it can be anything like gastritis, can be cholecystitis, cholelithiasis. That's a diagnosis. So you basically just pick it up from the question paper, that is a case note, and then you write in your introduction. Then another decision that you need to make, let me also tell you that sometimes when you're writing a letter, there's no diagnosis. Maybe there's just a provisional diagnosis or there's an ongoing issue. Ongoing issue means having persistent headache or having continuous pain, ongoing depression. So we have not diagnosed yet, but it is in the system of getting diagnosed, right? The second decision that you need to make when you write the introduction of the letter is what do you want from the reader? What do you want from the reader? Yeah, that's very easy to find actually. Sometimes it can be given in the middle of the case note somewhere, but most of the time it's always going to be towards the bottom in the writing task. You can see. So write a letter to home health nurse. So this person who's receiving the letter is a home health nurse, right? So what do we exactly want from the receiver of the letter, Mr. Minsuk Park? We want him to visit the patient's home every day for For what? For management, right? And look at the second half of the letter. Write a letter to occupational therapist Claudia Mayhem to outline the home assessment. So what we are exactly asking from the reader of the letter is home assessment. That means this person, Claudia Mayhem, is going to go to the patient's home and is going to assess if the living condition or if everything is suitable enough for the patient to walk or do the activities of daily living. That's called ADLs, right? In OET language. Yeah. So after we've made this decision, let us see what to write in the introduction. Let's see what's going on with the patient first of all. Yeah. So let's say just wait a second. Let me mute everybody so that we don't get disturbed. So what is going on with the patient? Diagnosis: left hip replacement following fracture sustained after fall. That is the initial. And what did we do while the patient was admitted? Let's see. Let's say what did we do? The management basically. So the patient came on 23rd September 2018, and the patient is getting discharged on 28th September 2018. And what happened was there was a fracture after the patient fell, and we did the left hip replacement procedure for the patient after the fracture. So this is what is going on. So it's very easy. Introduction. I am writing to refer Miss Shaw, who the age is also given. It's better to include age and even the marital status. She is what? Let's say charger. Height, weight, discharge. Nothing. Is she a widow? Yes. Look at this. She's a widow. It's better to always include it in the introduction of the letter. Sometimes you can also write it in the other part in the social where you're writing about the social background. Yeah. So I like to put it there. Or I even like putting profession there sometimes. So I'm writing to refer Miss Shaw, a 75-year-old. Yeah. Remember, this has to be hyphenated. Year old widow. Yeah. Who underwent a successful hip or left hip replacement surgery. She needs home visits after her discharge. DISCHARG. After her discharge today. Done, right? So what is going on with the patient? What do you want from the reader? So what is going on with the patient? Underwent a successful. You cannot write that successful there. You can just write who underwent a left hip replacement surgery. You can also write that who underwent left hip replacement surgery for the fall that she sustained. But we have second paragraph to write about it, so we can talk about that as well. Yeah, this is the introduction of the letter. Now no matter who you write to. So if you're writing to the home health nurse, Mr. Minsuk Park, obviously you're going to write that. Now, when you're writing to an occupational therapist, what is going on with the patient is not going to change. But what you want from the reader is going to change. That's going to be home assessment, right? I hope you understand. Now, the second paragraph is completely going to vary. Let us see how does the content of the letter change when you write to a nurse and when you write to an occupational therapist. Yes, you have to understand this. So let me read this thing out. Let me explain you. And we're going to write both uh, for both home health nurse, and we're also going to write for the occupational therapist, right? So let's read this. So you are a charge nurse at the hospital where a patient, Miss Shaw, was admitted. She's ready for discharge. Look at the patient's details. Miss Cindy Shaw, 75 years old, height 5'2", weight 180 pounds. Then we have admitted 23rd September, discharged 28th September. I've told this earlier, and I'm telling this now as well, that always subtract the discharge date with the admission date so that you know how many days the patient was hospitalized so that you can use that in your letter. Yeah, assessors love it. So, diagnosis, we've already talked about the diagnosis. That's a left hip replacement surgery after sustaining a fall. And then let's look at the medical history. Diabetes mellitus, diagnosed 20 years ago, pre-cause 25 mg. That is a medication that has been prescribed. The patient is under pre-cause 25 mg for the diabetes mellitus that was diagnosed 20 years ago. No other comorbid condition. Okay, if something is no, then we don't mention that. We don't include that in the letter. Yeah. So let's see the other parts. Social background, lives with daughter and son-in-law. 30 is no children in a granny flat. Okay, spouse dead 10 years. Daughter leaving overseas next week for a year. Um, Let me tell you this thing. I hope you don't get confused. Next week, 410, that is going to be Jan, February, March, April, May, June, July, August, September, October 4th, right? Patient's daughter is leaving for a year. To move into a self-contained flat, a flat has steps on okay for walker. Why do they put a question mark? They want to tell the reader of the letter, they want to tell the receiver of the letter if the living or if staying in that place is conducive enough for Miss, what's her name? Shaw, after she gets discharged, right? So the main issue is this. She would be still living with her daughter and son-in-law, but since the daughter is leaving because of her husband's job for a year, they are moving her into a new flat where she's going to stay by herself, and that flat has steps. So after the surgery, um, somebody has to go home to evaluate if the living condition is suitable or not. That is going to be the occupational therapist's expertise. Yeah. But the home health nurse is going to go more for the care, like, for example, dressing or any other issues that she experiences, pain management or infection or all those things. Yeah. All routine activities independent. She's able to do all her routine activities independently, exercise regular, walking 30 minutes a day, 5 days a week. Yeah. Then we have nursing management. So let's see. So she walks, right? That's what we know, 5 days a week. Now let's check the other heading. So patient presented when? 23rd September, right? So here 16th September, and then we have 23rd September, then we have 24th September, 25th September, 27th, 28th, right? Don't get intimidated by all these dates. We just need to find the information that is needed for us, and we place that in the second paragraph. You can write overall whatever happened during how many days of hospitalization. 28 minus 23, that's going to be 5 days of hospitalization. So clearly 16 by 9, that's September 16, that is pre-operative. So we don't care much about the pre-operative, post-operative. Of course, the OET examiners or whoever creates the question paper or the case note, they purposefully give you, they will load the question paper with unwanted information for you to include, but you don't need to include everything. You need to think, which one do I include and which one do I exclude? Okay, so let's anyways still read it out so that we have a better understanding, so that when I exclude something, you will know why are we excluding, right? Let's see, September 16th, pre-operative, her HbA1c 6.5, fasting 125 mg per dl, postprandial, blah, blah, blah. Good control before the surgery. Then she presents on, how many, 16, 17, 18, 19, 20, 21, 22, 7 days later. She comes post-operative, that's the story. When was the surgery done? Let me see. 23rd. Okay, she came on 23rd. That means surgery was done on 23rd. So what happened? Hemoglobin, HbA1c, like is 7.5, then fasting 160, postprandial is 250. Cause, how did it happen? Stress hyperglycemia. Why does it happen? Because of the surgery. Given 2 units of insulin, catheter, and IV fluids with pain relief medication was given. That is the day when the patient got admitted and after the surgery, right? The following day, decreased mobility, compression stockings for blood flow, pre-cause increased to 50 mg post-operatively. Which was the pre-cause? You see in the medical history that the patient has already been on pre-cause for the past 20 years. Now, considering the value change of the sugar, I mean the sugar level, the change in sugar level, they have changed the pre-cause's dose. So they've changed it to how much? 50 mg from 25. That's double, isn't it? Right? After that, the following day, 25th, able to walk to the bathroom with a walker, catheter removed. Yeah. So you see on 24th, decreased mobility, but you see that she's gradually progressing. She can do things with a walker. And Vicodin, 7.5 mg given for pain. See, we should not be very worried about all these pain medication. If it is continued, you see in the discharge plan that please continue the pain medication, then you need to include. Otherwise, it's not very important to include the dose and everything. You can just give an overall outlook that, okay, see, when the patient was admitted for 5 days, we gave this medication and that medication. Our pain was managed. Yeah, look at the 27th, compression stockings removed. So we gave, okay, on 24th, compression stocking for blood flow, for improving blood flow was given. And how many days later? 24, 25, 26, 27. 3 days later, compression stockings removed. And look at the following day, 28th September, readings at discharge. It's all controlled, right? It's back to normal. So pain described as 5 by 10 increases after walking for 5 minutes, 7 by 10, although she is fit for discharge, but she still has pain. It's not an extreme pain, but the pain's still there. And on prolonged walking, you are seeing that the intensity of pain increases, right? Now, moderate mobility, walks around 50 to 60 steps with the aid, incision site slowly healing, daily dressing required, staples removed in 2 weeks. That's future plan. Let me tell you that this is the events of 28th September. Staples removed in 2 weeks, Banepachi. It should have been in the discharge plan, isn't it? But they purposefully placed it there so that you include it there itself and you make a mistake. In reality, in actuality, what you have to do is you need to write the staples, removal of the staple somewhere else in the discharge plan. Yeah. So they will put things in all wrong places and they want you to fall into the trap, but you should not fall into the trap. You see that there are things that has to be done in the future. You can put it in the discharge plan, but we have a lot of things lot of things in the discharge plan. But I've already clarified the at the in the beginning itself. Look at the writing task. Why do we have so much in this particular letter? Because this is just for you to practice. There are two recipients of the letter, right? First one, home health nurse. Another one is occupational therapist. You get it, right? So now let us see how the second paragraph is going to change and how are we going to summarize whatever happened here. Yeah. And remember, everybody noted down that, the second paragraph should always have a main concern. But the main concern can be subjective. It depends on person to person. Maybe I may be thinking, okay, this is the main concern. Somebody else can be thinking, this is the main concern. But you should always have a habit of writing something that you think is the main point about the patient after the patient is discharged. So I'll give you an example as well. Now, how do we summarize? See, I would not include all these things, preoperative findings. It's useless, right? Post-operatively, you see that she was hyperglycemic, and then later at the time of discharge, everything is normal. So there's no point giving all the details that on this day, this happened, on that day, that happened, or we're giving description of a particular day. We don't need that. We can just write in the second paragraph, like in 5 days or during 5 days of hospitalization, what did we do overall that the patient is fit for discharge? So we've already talked about the introduction of the letter. Now we're going to talk about the second paragraph of the letter. Let's see what we write in the second paragraph of the letter. Okay. Now let us find few points, and I am also doing it in front of you. So maybe there are things that we're going to take from here and we're going to remove from there, and there can be mistakes, but we will work it out to the end of the class. This is how it happens. Okay, now let's see what do we write in the second paragraph. So you must be noticing here, we have to generate ideas. Now you're writing to the few points that I want to clarify, that the reader of the letter is home health nurse. I've already repeated this so many times. Why is it important? Imagine that the patient was still living with her daughter and son-in-law, then the home health nurse would have not been required, isn't it? So that means in the second paragraph, you need to tell the reason why you are asking Mr. Minsuk Park to visit home. So that means, what does that imply? It implies that, wait, goodness, wait a second. Just a second, sorry for the interruption. Okay, so so she, her kids, her daughter is going abroad, isn't it? So you need to mention that. That's the reason why we want the home health nurse to visit that Mr. Minsu Park has to visit home, right? Another issue is, you should always check what is in the discharge plan. Sometimes there are things, that needs to be continuously monitored. Therefore, we can include that also in the second paragraph. Let's just check it out. Okay, what's the discharge plan? Let's say physio, range of ROM and strengthening exercises for weak arm. Scar tissue massage can be considered after incision heals. Okay, balance exercises. Then we have occupational therapy. So since we're writing to the nurse, we don't need to be overly concerned about what is going on with the occupational therapist, right? Occupational therapist, uh, we'll have another letter for occupational therapist. Even in the exam, you should think, okay, they've given it in the discharge plan, but it is none of our business. If they say that write a letter to occupational therapist, that's going to be a different story. Yeah. So you could, but here we are writing a separate letter to occupational therapist. So we're not including this. We are asking the reader of the letter to just come home and see if the home's environment and is conducive or not. That's going to be your occupational therapist thing. And if you're writing to a healthcare nurse, sorry, goodness, home health nurse, um, those scenario is going to be different. Okay, so check this out. What else do we have? A sock and shoehorn, reacher, dressing stick, and raised toilet purchased by daughter. I am really. Let me tell you one more thing. The relevance and what to include in your note and what to not include your note can never be 100% correct. Really. So these OED people, they say that, okay, this is relevant, that is relevant. And when the letter changes, they will say this is relevant and that is relevant. They, in my opinion, they don't even know by themselves what is relevant and what is not relevant, because we think like medical professionals, so we should stick to it. Even though if we include one or two irrelevant information, it is not going to get you failed. If the overall letter is fine, and if you are on point, if one or two extra content is included or excluded, it is not going to matter that much. Remember these words that I've said just now. So sock and shoehorn purchased by daughter needs to be shown how to cook meals. Now, I don't know, like, whose job is this, to be honest. Maybe it's occupational therapist job. I mean, is the home health nurse going to teach to cook? I am really skeptical about this, so maybe I'm going to include in both letters. Can resume mild exercise after 12 weeks, subject to physio review of progress. That's none of the business of occupational therapist. This one's going to be a nurse, and yearly x-ray. This is also for the nurse. Obviously, it's occupational therapist is just going to come home and see if the living environment is suitable or not. That's it, right? Anything that is related to monitoring of medication? You notice anything? No. So we do not need to be very focused. What candidates usually do is they're going to mention everything. Post-operatively, the HbA1c was 7.5, the fasting was 160 mg per dl, PP was this and that. They will be expanding each and everything that is given there. But let me tell you how it is really done. Okay? So so you notice here that pre-course 25 mg, and in the letter it doesn't specify anywhere that the pre-course dose has been changed back or reverted back to 25 mg. So you need to mention that, okay, the patient is still on 50 mg of pre-course. Yeah. So introduction, we've already talked about. Now let's talk about the second paragraph of the letter. What do we do with the second paragraph of the letter? It's going to be like this. Let's say Miss Shaw underwent underwent the surgery after having sustained a fall on 23rd. What was the date? September. September. Or yes, we can start in many ways. Miss Shaw, see, underwent the aforementioned surgery. Aforementioned surgery means that's the introduction of the letter. We've already said that left what is it, knee replacement or something was there. Or we'll find it. Well, let me just check it once. Yes, left hip replacement surgery. Yeah. So Miss Shaw underwent the aforementioned surgery. You can also do that. Miss Shaw underwent a procedure, or surgical, or we can give the name also if you have not written anything at the top. But if you've already given at the top, why to repeat the same thing again? So Miss Shaw underwent God, wait just a second. Wait, let me text. Sorry. Okay, so see here, Miss Shaw underwent a surgery. Oh, sorry, underwent the surgery. The surgery after having fracture, after sustaining a fracture, FRCTUR fracture due to a fall. She was operated on the same day. Sorry, on the same day, on the very day, or her operation, her surgery, or her operation. Sorry, her OPERAT operation was done on the on the same day of presentation. Same day of presentation, or you can merge all of into one. So these are the options you have. Yeah. The important thing to note is that she has been diabetic for the past how many years? 20 years on the pre-course 25 mg, which was doubled to counter the stress, or counter the stress glycemia after the surgery. Yeah, her readings, we can mention a little bit. So her HbA1c, her whatever that was, HB, wait, goodness, A1C on, and what was there? One more, right? And copy paste were this and this respectively. However, at However, at the time of discharge, it has normalized to blah 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 and blah 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 value. You understand? Note it down, guys. You're going to memorize this, but don't copy exactly the same thing in your writing. This is the way you get very high band. We are not expanding the note, but we are transforming the note depending on what we understand. Yeah. There are many options in which, there are many ways in which it can be written. Now, copy this so that you know, like, what is exactly expected from you. The exact expectation is the transformation of the note, not expansion of the note. Most of you and most of the candidates and most of the students that I teach, they make the mistake of expanding and not understanding what is going on. Things, introduction of those things like double, and understanding between the lines, understanding from the beginning till the end, what is the real story, and expressing that by yourself. That's the art of writing, and that's the way it should be written. Yeah. So expanding can never get you a B band. You'll get maybe a somewhere around C plus, but nothing more than that. Remember, note this down. I'll give you 2 minutes. After that, I'm going to come back to other options. I'm going to come back to other parts. If you can see, if you cannot see it on the screen, maybe it's because of the network, or maybe you have not updated to the latest version of this app. In that case, I'm just going to read it for you. So her operation was done on the same day of presentation, or her operation was done on the same day after she had a fall and fractured her hip. The important thing to note is that, or the main concern, no, let's not do the main concern. It is worth mentioning, please note, she has been diabetic for the past 20 years under Preco's 25 mg, which was doubled to counter the stress hypoglycemia. After the surgery, her HbA1c and da 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 were initially high. However, at the time of discharge, it has normalized to this and this value, right? You can write that. You can, since we're talking about management during the 5 days of hospitalization, you can also talk about everything in general. You can say that during 5 days of hospitalization, she received pain management, uh, including a. I'll tell you. Just copy this first. I'll give you many methods in which you can write, and you can choose which one you want to do. Done? Okay, I'm erasing it. Now, yeah. Now look at this. Another. After that, how do we continue? We can introduce the main concern. The main concern is that her daughter and son-in-law are leaving abroad. Therefore, she is being moved, or she's moving She's being moved, moved. Moved. When you show variation in the way you express, like she's being moved, I'm changing the way I'm writing. She's moving, it becomes continuous. She will move. Don't rely on the same way to express yourself. You should show different ways in which you can form sentences, because there's also a section called language from which you're going to get scoring, right? You're going to be graded, and that has a lot of points. Why to miss that? So don't always write, she needs, she requires, she requires. I've been seeing many candidates, they have the same writing pattern for all the sentences formed. Bring a little bit of variation, show the assessor, see, I can write in many different ways. Give me more points from there, right? She will move to a new flat where there will be nobody, nobody to, there'll be no one to care for her. Now you understand. Now we get the idea. Okay, see, Mr. Minsuf Park, please, this is the reason. Now, to be honest, we can put this one first as well, right away, that she underwent a successful surgery, but the main concern is that she is moving to a new flat because her daughter and son-in-law, they are leaving abroad. Oh, sorry, this one for mistake. Please ignore. I'm really bad at typing. SON Pochi, there's 0. You get it, right? Whatever I'm saying. So we could have also done like that. So surgery was successful, everything under control. She's fit for discharge. Everything has normalized. She received this kind of management, but the main concern is this. Or you can say the surgery was successful, but the main concern is this, and tell the current status of the woman. Yeah. So another option. I'm giving you many versions. You write in your own way. Please don't copy my style. You can find your own way. Sorry. Yeah. Here. Yeah. Okay. After this one. Wait. What was the other version? Now. Yeah. Another version. Let me think. Okay. So Miss Shaw, after the surgery, had restricted mobility, 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 which improved with time after she started using walker and was even able to independent INDEP and DE INDEP and DE and TL independently go to the bathroom. Presently, now she is able to. She is able to. She is capable of. See the styles change in the ways. You can write in many ways. She's capable of walking 50 to 60 steps. 60 steps with a pain scale, with a pain rating of RA, a rating of 5 by 10. 5 by 10. However, with DIST, distant walking or prolonged walking or walking continuously, walking, yeah, all these versions, walking prolonged, anything, continuously. She can, she has aggravated pain, worsened, a worsened pain that she describes as 7/10, isn't it? Note it down. Yeah. Or we can separate out a nursing management. Nursing management, we have during 5 days of hospitalization, compression stocking was given, pain medication with Vicodin was done, right? Or her pain was controlled with Vicodin. We can also put that nursing management can be separated out. See that we know that the body paragraph should not be written ideally more than 80, right? So adding everything into one, of course, can worsen the situation. So I suggest you choose by yourself with your own acumen. So we can write the success of the surgery in connection connected to the main concern and her current capabilities. Or you can, in the second paragraph, we can write how we manage the patient for a period of 5 days that is leading to successful discharge with current consideration regarding the mobility and pain, right? So you choose by yourself. So no matter which we do, like let's imagine we chose um, the success of the surgery and the main concern, that means nursing management is going to be the third paragraph. If you make the nursing management in combination of what is going on with the patient as the second paragraph, then the other things are going to move or shift to the third paragraph. Discharge paragraph already has its own uh, designation, so you do not need to be concerned about what to write and what not to write in the discharge plan. Discharge plan you can always separate. So we made a decision of what to do with the other things here, right? So we've basically combined 5 days, 5 days of hospitalization into one paragraph, and then staples removal. It's already in October 9th, so we can put it in the discharge plan. So discharge plan is not difficult to write. So what I'm going to do here in the discharge plan is that I'm going to exclude. You are lucky. What is it? The occupational therapy part, because that's not the duty of the home visit nurse, right? And I'm really confused about this no bending and using reacher. Is it the occupational therapist job, or I don't know if it's a nursing job? So I'm going to put it anyways. I've mentioned you guys earlier that you can never be 100% correct. Yeah, there's also a little bit of guesswork involved, right? You will see many videos on YouTube, these from OET official sites, and then um, many other, institutes. They will say this is relevant, that is relevant, this is not relevant, that is relevant. You can be approximately relevant. If you include or if you exclude few things, it's not going to change anything, to be honest. You have the main motive is to pass, and you'll pass anyways. Now, having discussed all these things so far, now let us talk how will this letter change if the reader of the letter is an occupational therapist. So occupational therapist, we've told, it's all about the home assessment. So introduction of the letters, the second half of the introduction of the letter, there is that what is going on with the patient, what do you want from the reader? In introduction of the letter, what is going on with the patient underwent a successful hip replacement surgery after sustaining a fall. Or you cannot write about the fall injury in the introduction itself because it's not good to complicate your introduction. Be short and sweet, done. In the second paragraph, write the same thing that we did for the nurses. See, I'll write it, I'll type it. Everybody note it down. How will it change? So Miss Shaw presented on 23rd of or 23rd September after having fractured her hip that resulted in the MENTIONED surgery. Yeah, that resulted in the aforementioned surgery. She is currently stable. She's currently stable. However, we always have punctuation mark, remember? However, describes pain on mobility. MOBIL, mobility, right? The main concern, again, the same. The main concern is that she lives with her daughter and her husband. See, son-in-law like change gardiyo. We changed the son-in-law. Her husband who are the primary caregivers. However, no, we've used however already. It becomes boring structure. You see, stable was however I've used. We're going to change that. So who are the primary caregivers? Now, how do we put but since I'm making compound complex sentence, but since they are leaving, leaving abroad for a year, Miss Shaw is moving to a new flat where she is on her own. Considering the event, or considering the surgery, or considering the considering her recovery status, the stairs at her new home can be problematic. Therefore you're at 30. Where did I write? In the therefore your home, ASSEMENT. Hey, one. I'm very bad at typing. I'm really sorry. ASSESSMENT. Your home assessment is warranted. Learn this word. Warranted means chahiyo, needed. Is warranted, needed, is warranted, or we can also change your expertise is needed. You get it. So now look at this. When we were writing to the nurse, we're talking about all those pre-courses. 25 mg double to 25 mg, sorry, double to 50 mg. The patient's pain management. We're talking about stockings. We're talking about various other things. But no, we don't care about that when you write to a non-medical professional. That's allied healthcare professional. So we tell the main thing, and after that, what are you going to write in the next paragraph? Are you going to give the details of all those things? You can even add the social history in there. You can talk about her spouse being dead. You can write about all that thing. You can even include the date when her kids are leaving, right? After that, we do not need to include anything here. Basically, we could just say that during 5 days of, we can talk about how she is stable and what is she able to do. Like you can talk about the 50, 60 steps in detail. You can write that somewhere. But we're not going to talk about the daily dressing. We're not talking about staples removal. We're not going to talk about blood sugar monitoring. We can talk about, yes, the incision side is slowly healing, and then she's able to move with a walker or the aid. Yeah, copy this first of all, and then we're going to talk more. We're going to discuss more. Done? Yes. Okay. Now let us choose from the discharge plan. The letter to the allied health care professional is going to be short. It's not going to be very long. Yeah, we're not going to talk about HbA1c because it has no value to the reader of the letter. The receiver of the letter, even if the receiver of the letter knows that, okay, look at this, HbA1c is this, fasting is that. I mean, Vicodin is this, that. They don't care because that's not their job, right? So here we're going to talk more about in the discharge and what we're going to choose. Okay, maybe we can say that her arms are weak. We're not going to write about the whole strengthening exercises and all those things. Arms are weak. Massage is not the job of the occupational therapist. The balance exercise, I don't know. I mean, it's also not the job of the occupational therapist. But here, this is directly related to occupational therapist. Non-slip mat for bathroom rails. This one, 100%, is the thing that is relevant to the occupational therapist. So, so after the surgery, the occupational therapist is going to go to Miss Shaw's new flat and see that, okay, see the toilet is slippery, the bathroom is slippery, and the stairs have no rails and all these things. So that will be the job and duty of the occupational therapist to install all those things so that the patient is safe after the discharge, right? So this one's directly going to go there. Then with the shock and the sock and shoehorn, we have to write about this one. I am really not sure about this one, to be honest. Needs to be shown how to cook. Maybe include it. I am not going to talk about anything else. Yearly x-ray is not going to be the job of the occupational therapist. Mild exercise is also not. Maybe we can write, she's permitted to do activities in 12 weeks. Therefore, the arrangement inside the house that she's going to stay should be more organized, right? So you choose on your own. So here, maybe let's say, let's choose. Weak. Let's say we can talk that the patient is weak, right? We can talk about that. Weak one. This then of course this one we're going to talk. Then we're going to talk about this one. We're going to talk about this one. We're going to talk about this one. And then we can say that in 12 weeks she's going to be more active. Therefore, home has to be more organized. Yeah, conducive to living. You understand? So when you write the same thing to the nurse, the occupational therapist's part we're going to remove, and the rest of the things I think we're going to include. Or maybe we can talk about the shoehorn and we can remove this, or maybe we can mention that to the nurse as well. Yeah. So the nurse's job is more going to be, that what kind of exercises and massage and all those things, and monitoring of blood sugar. You see, they've hidden it here on purpose. Look at them. Yeah. Incision site slowly healing, daily dressing required, staples removed in 2 weeks, monitor blood sugar level. That's the duty of the nurse. And they're hiding it on 28th of September. They should have actually put it here. They should have planted this information here in the discharge plan, which they have not. Yeah, understand? So I'm expecting this letter. We'll check everybody's letter. Whoever has done this, we're going to check this tomorrow. Yeah. Okay. So we have two versions of this letter. So who are doing this for the first time, we have to do two letters. Who have already done one, or they will do the next one. Or if they have done both, we're going to check this tomorrow. And I'm going to point out all the mistakes. Yeah? Understood? This is how we manipulate the information.